This week's program was filmed at Medical City, Dallas. Founded in 1974, Medical City is recognized for its state-of-the-art medical facilities and commitment to excellence in patient care. Located in Dallas, Texas, the hospital's medical team consists of more than 1,150 physicians, many of whom are recognized as the world's best in their specialties. Medical City, specialists in life. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Welcome back, everybody, to Platforms, a life-lifting news program for women. I'm here with Dr. Joseph Kuhn, and we're talking about the various bariatric surgical procedures. Dr. Kuhn, many people, lay people have, I believe, have this impression that these type of procedures are extremely risky or dangerous. Is that true?
Well, they're life-changing, but I wouldn't say that they're extremely risky. When you look at centers that are considered centers of excellence, so they've done, let's say, 1,000 of these procedures, the risk of doing any one of these procedures, the risk of death is less than 1 in 1,000. And that's less than taking out your appendix. It's lower than most operations. So it's a safe operation.
Would you define Center of Excellence for us? You've mentioned that a couple of times, and that is a very significant designation.
Well, for example, here at Medical City, they've been doing bariatric surgery for 25 years, and one of the oldest kind of established programs in the country.
Wow.
Center of Excellence is defined by the national organization, the American Association for Metabolic and Bariatric Surgery. So it requires a close follow-up. We have to keep track of the outcomes of all of our patients, and we have to have an integrated team, both in our office and at the hospital, to care for the patients during surgery, before and after.
Let's talk about this integrated approach, because I think that's fascinating. A lot of medicine is embracing this, but there are many psychological factors associated with this morbid weight gain, and then how do you take the patient from post-op to improving their life, so to speak? So it's very important, isn't it?
I think you're right, it's critical. The surgery is only a tool, and I tell patients we are not instilling willpower in them, we're just evening the playing field so that they have a smaller stomach. In reality, it does require nutritional guidelines. So you have to have a dietitian. We have a committed dietitian. The hospital has a committed bariatric trained dietitian. Psychological support. There's a fair amount of stress associated with being obese and with living in America right now.
Yep. And
stress tends to cause people to eat foods that are comfortable, and they tend to cause us to overeat. So learning how to deal with stress, it's one thing that we cover in our support group meetings. Medical City has monthly support group meetings. Probably every third one is how to address stressful eating and how to change that behavior.
Are these procedures, generally speaking, covered through insurance, so they're not considered cosmetic?
They're covered by a lot of insurance. Okay. The downside is that across the country, it's sporadic, and probably 25% of all Dallasites are covered by bariatric surgery.
What was that percentage again?
I would say it's about 25%.
25%, okay. Let's talk about, this is considered a treatment of last resort by many people, people that have tried to lose weight the old-fashioned way. A great example is, Oprah Winfrey herself, who struggled with her weight, considerable ups and downs. In her situation as a trained doctor, what would you say is her biggest, is it a function of her genetics where she's had these great challenges throughout her life? Because I don't think she's ever reverted to any weight loss surgery.
I think in her case it may just be a matter of her genetics that led or contributed to her obesity. Stress, and she would probably be the first to acknowledge that stress had an impact on her.
Sure. And
then eating behaviors.
Doctor, you had alluded to earlier, and it really stuck with me, that this is people that struggle with their weight. It's not a character flaw, it's not a moral issue, it's a physiological phenomenon, and I think a lot of people don't really get that, those who don't have those kind of struggles.
If that's the only message that we send out, is that this is not a problem with willpower. I mean, I've had 2 siblings who have morbid obesity. One's had the surgery, my mother had bariatric surgery.
You've had 2 siblings that are considered morbidly obese.
And so we see clear patterns from mother to father. Today we operated on a 15-year-old whose both parents have had weight loss surgery. And the genetic pattern is so obvious to the unguided eye. And we now also know about the 10 or 12, the multiple genes that identify for for hunger patterns, for metabolic rate. And so we live in a time where, you know, we have to realize our bodies are designed to eat when the stomach is empty. And unfortunately, it's a pattern not just in America, but all across the world, where obesity it's a consequence of our genes, our environment, and it's not a matter of willpower.
Right. You know, it's interesting that you say that, because I had an opportunity to travel to Japan last year. Now, in that country, I think obesity is a relatively small percentage of the population in that culture, in that environment, but then you bring in the westernized influence, and then you start to see, like you said, a little bit of a spike in terms of the incidence of obesity.
I think you're right about that.
Right. Let's talk about you and your colleagues, the comprehensive treatment plan you have at Medical City. Talk about the team approach. So if someone came in and got gastric bypass, could you take us through like the pre-op, the surgery itself, and then the plan that follows, like kind of soup to nuts?
The total package, when you come, you will typically get roughly 3 months of preoperative diet planning. Almost all insurance companies require it, and it's a good idea.
Right, right.
So you'll meet with the dietitian monthly, the surgeon, or a bariatrician, but you'll learn how to eat properly. You'll undergo a psychological evaluation, and so they'll do a panel of tests. They'll identify if you have a binge eating problem or if you have unresolved pressures or stress. They want those taken care of before. Then the surgery it's a team effort with the same key group of nurses, the same floor. Everybody's educated, not just about sensitivity training that they receive, but physical things of how to take care of patients who are 200 pounds overweight.
Right.
The surgery itself is gotten to a point of being pretty standardized. Each operation takes less than an hour usually. In our
Less than an
experience,
hour? Wow.
in our experience, probably 90% of patients go home the very next day.
That's remarkable.
The follow-up is pretty regimented. It may be at 2 weeks and at 6 weeks and 3 months, and then depending on which operation, it might be even more frequent than that. But
Right.
it's a close alignment with the surgeon, the facility, the support groups.
You know, you mentioned your siblings earlier. I mean, you're obviously very trim and in good shape. So in this instance, how would you, is it a genetic factor with your siblings, or is it more of a?
I would say so. We ate the same food. We were under the same stress. So the same environment, but there's just different genes that code for the metabolic rate and what the hunger elements are. So.
It's remarkable, yeah. We're going to go to break for this last segment, so when we come back, if you could stick with us, one more of this fascinating information. Folks, this is Siobhan Palmer with Platforms, a life-lifting news program for women. We'll wrap up our discussion today with Dr. Joseph Kuhn in just a moment.